Probably the best news is all K through 12 staff can be vaccinated. So that's a really good thing. Allows us to move forward. The more people that get vaccinated, the more likely we're going to get to stay in phase 3, which I'm going to talk about a little bit. The less disease we have, the more we can get back to normal. So mostly I'm coming from a place of yes these days, where if you remember last fall, I pretty much told you no to everything that you asked me. So it's a switch, and it's a good thing with some concerning aspects coming up. So we'll talk about those. So if you've not been vaccinated, please go get vaccinated. We moved into 1B tier 2 today, which really opened it up to lots of other folks. And due to confusion, which is standard for COVID, we were having difficulty filling those spots, and that is concerning. So if you want to get vaccinated, please go get vaccinated. If you're meeting if you're currently in the phase, what I think is going to happen with vaccine, and I don't have a crystal ball, but there's a lot of discussion about vaccine. Mostly what we're doing is limited currently by vaccine availability. We're getting more and more vaccine from the federal government on a state level. And I think what will happen in Washington state, certainly before May 1st, which is when President Biden says everyone over 16 has to have the availability of getting vaccinated, that'll happen before that date in our community. I can't tell you exactly when, but Alaska and Arizona, I think Michigan, and maybe a couple of other states have already gone that direction. So we're getting some direction from the federal government on lots of things, which is actually helpful, which we were crying for last year to have some direction. So it is confusing direction sometimes, but I think that's where we're going to be going for vaccine in the next few weeks. So if we can, well, I'll get to that in a second. So phase 3 starts for most people on the 22nd of March, but it starts with high school athletics prior to that. So why did it get why did they do something different for high school athletics? And that's because they're wanting to allow athletics seasons that are ending soon to have more fans in stands. So there's not very many more games left for some of those student athletes. And if it was going to happen next week, they wanted it to happen this week. So that's why that occurred. There will be a lot more. What you saw from the governor's office was a very sparse, this is what phase 3 is, and these are the metrics that you have to meet to either go forward or go backwards. There's some problems with those metrics, and I'll talk about how we fixed those yesterday. But there's a lot of interest groups that are working with the governor to come up with specific guidelines. So I would expect guidelines on things like nursing home visitation to happen this week. I would expect guidelines for overnight camps to happen either this week or next week. So there's a lot of work that's happening very quickly on the state level in regards to directions. And if they're opening up to phase 3 next week, they still, even if we don't have all the guidelines on that, they'll still be coming, but they obviously have to have them done before April 12th when they look at those phases again. We are moving forward on a countywide approach. None of us really thought that the regional approach was a very good idea. The reason the regional approach was done is because we were really worried about hospital capacity. And what we have found over the last couple of months really, that we really haven't had a problem with COVID-19 hospital capacity. We have had some places that have had hospital capacity issues, but that's more of a structural thing than a disease thing. And if hospital capacity is not the biggest problem, then it doesn't make sense to have a regional approach. And the reason we were put in the South Central region, because most of our transfers either went to Yakima or they went to Seattle, and so they put us in with Yakima. Phase 3 allows for a lot more activity. Basically, you should look at most of the things that were allowed at 25% capacity are allowed at 50% capacity. There's no specific guidance on phase 4 yet, but we as a group that came up with some of those guidelines for phase 3 said we thought that phase 4 should be at 75% capacity. So those things will be coming. Our numbers in the county are actually going up. Here's some bad news. Our incident rate is 262 cases per 100,000 per 14 days. That was based on February 20th to March 5th. We have a couple of outbreaks in long-term care. We've not had any outbreaks in long-term care for a long time, but these are in daycares. And what you might hear coming down the pike is the discussion on who's transmitting the disease. Well, for the most part now, the transmission, and it has been for a long time, transmission has occurred in our state for people that are 19 to 40. So there's a big push to, now that we've vaccinated a good portion of the people that are at highest risk, teachers, grocery store workers, people in nursing homes, first responders, that we should consider starting to vaccinate kids older than 16, because that's where the vaccine is approved for older than 16. So you're going to hear a lot of people talking about that we should be vaccinating people who are spreading the disease. And that is certainly true in our county. So the outbreak that we had in the nursing home last summer was related to people in that age range when we went into phase 3. None of these people are doing anything bad. They're just doing things that are normal in a normal time, getting together with friends, going out to dinner, watching video games, but it's the same population we're seeing currently. Older, high school aged kids that are working, but not really very many of those, but certainly lots of college age kids that are working. So when we look at who works in nursing homes, who works in long-term care facilities, who works in fast food restaurants, who works in daycares, it's college-age kids, either kids in college or people that are just working in those facilities. So, so we have lots of vaccine in the county. Our incident rate is going up. I'm concerned about that, and I'm concerned about that because unlike what happened last summer, where nobody was really pulled back from phase 3. None of us that were in phase 3 got pulled back into phase 2. If we as a county are not continuing to mask and socially distance and those type of things, it's quite possible that we'll be rolled back into phase 2 or maybe even phase 1. It won't happen immediately, so it won't happen on the 12th of April. What we had recommended to the governor, and hopefully this comes through, is that at that April 12th, when they look at our numbers, if we're not meeting the current criteria, that they'll give us a few weeks to correct that. So because it might be due to what we have currently in daycare, we might be just having a spike. So we really need to encourage people to get vaccinated, because the more people that we can have vaccinated, the more the less disease that we have in the community and the more things we can do. So I'm hopeful in that regard. What they had done, the thing that we corrected yesterday, that they looked at small counties and they tried to make some fudge factor that allowed smaller counties where 1 or 2 or 10 cases would really throw their numbers off, that they wouldn't be punished, but they missed the mark on their math. So we corrected their math. So if you look at the governor's website in regards to what's required to stay in phase 3, there's this really weird number that says less than 60 cases for counties that are under 50,000. Sorry, less than 30 cases in 2 weeks, which for us would be an incident rate of 62. And King County, as a large county, is allowed to be less than 200 cases per 100,000. So somebody just missed the math on that, and they were trying to do the right thing. It works really well for a county like Columbia County that only has 5,000 people. So that's where we're at. Corey Wright and I have been working really closely together for the last year, but certainly since last August on schools. And so, the county's given schools money. Corey has different people that he can push. So I push levers on a lot of people. So I push on things that are inconsistent in guidelines. I push on things that don't really seem fair to me or don't seem correct scientifically wise. And those are all people that are pretty much in the public health governance side. Commissioner Wright has an ability to push on elected officials more strongly than I do to get what we need for schools. So I've asked Corey to be involved in conversations with schools because we've got a lot moving forward. The last thing I want to say before I ask Corey just to say a few words is last week I told Ginger in a meeting that we were only going to be able to change the 6-foot to 3-foot rule when hell froze over. So it looks like hell is probably freezing over, which is a good thing. There's a really good study that came out last weekend. It's a pre-published study looking at outbreaks in Massachusetts and in Wisconsin during the period of time over Christmas when numbers were crazy. And there was not any more transmission at 3 foot in schools than there was at 6 foot. And there's certainly not transmission occurring in the K-5 schools. So in the next few days, I would expect the CDC to come out with a document, an MMWR, which is their science-based document that says, here's what we see, here's what we're recommending. And then I would expect in the next week or so after that, the CDC to come out with a statement of, we think this is what we should do. And then it's gonna, and then there'll be a few weeks before we as a state come up and say, yeah, we're willing to follow that. But it does look like hell is slowly freezing over. And I have to apologize for Ginger because that was more of a flippant comment. And sometimes when we're flippant, things turn out to be correct. So, so that's where I'm at. Corey, do you want to say a couple of things?
Yeah, thanks, Mark. Mark and I have, as he said, teamed up. We both have a strong desire to see all of our kids back in school. We have a shared set of kids who were both seniors last year and didn't have the normal end of year festivities that seniors do. So we both recognize that there is a lot of work to be done to make this happen, but we're both committed to it. And as Mark said, I do have a different set of folks that I talk to as Mark does, but I rely on him for the science and data and the safe metrics. And then we put our heads together and find those potential inconsistencies and maybe how these rules are being made. And we work to get those changed for the benefit of our kids, which we both, as I said, want to get back in school to the fullest as soon as possible. If there's a way to salvage the end of this year, we're both trying to make that happen. And when I say salvage, I mean see all of our kids in school as to the maximum extent possible beyond where they are now. We both have that shared vision, and while we are probably view this from different lenses of risk at times, there is a Venn diagram in the middle, which we have found is where we are going to be concentrating on. And I'm very appreciative that he has invited me to be a part of this. So I may ask questions at time. I may provide comments, but mostly I'm here to listen and see where I can be applying my contacts to help solve the problems for this district as much as possible. Thank you.
Thanks, Corey. Yeah, Corey and I have certainly come to the middle on over the year on this whole Venn diagram thing. It shows that people who come from different perspectives have a lot of common ground that we can work together. And I think that's where we are as a county. I'm super excited that we are no longer, I mean, I liked our South Central partners. I like going to Yakima. I liked Walla Walla, but working with them was really difficult in regards to trying to convince people in our county to do the right thing so we as a region could move forward. And now it really puts the responsibility onto us. I wanted to say that we've been working with the group, the events group. So if you look at the school guidance, then the updated school guidance came up on May 11th. They changed the wording under, I think it's page 8, that talks about what things we can and can't do. And they changed the wording on events that says schools should consider the possible steps to reduce, or schools may consider the possible steps, including things like canceling large events and those kind of things. So I've been working with the school events folks, both in Cle Elum and Roslyn and Kittitas, and because we are really trying to find ways to do things like graduation. You know, I was impacted individually last year with sports and graduation, and we're going to make it work. I'm on a school opening community of practice that meets on a weekly basis, and we talked yesterday on events. I brought up the whole idea of frozen turkey bowling, which nobody except people in Kittitas County understand, but and talked about things like graduation, and some communities are even kind of trying to figure out a way to have prom, which is problematic from a close contact thing, but we're making it work. So so Michelle's asking, we're getting a lot of questions about next year. When will we be back? Will we have to wear masks? Is there anything we can refer to in metrics that would help people understand next steps? So I've been working closely with Central Washington University since March, since I told them they couldn't come back from spring break last year. Some of that I did because I felt guilty, and some of it I felt did because they're a big part of our community. They are planning on coming back fully next year, full dorms, full classes. They will do masking on campus again next year. They don't have to do masking, but at least currently they're planning on doing masking. If the numbers so what I expect to happen, I expect we're going to have a blip after spring break. And so for those of you that are choosing to travel over spring break, try to stay within your bubble, do the things that are safe, come back and be tested, realize that we're increasing our risk, and we know we're going to have a blip. Unfortunately, that April 12th, when we're looking at the metrics, comes 2 weeks after spring break. So we'll have a blip. We'll have a blip both because of travel and because of the variant disease that's happening in the United States. We have B117, which originally was found in the United Kingdom. We have a current outbreak happening with the South African variant. And so we know that we're going to get a blip from these. Hopefully the blip's not going to be very high. And I think what's going to happen is, we're getting more people vaccinated, the blip won't be very high, and it'll be pretty quiescent over the summer. So it'll be different than last summer. Numbers will be low. I think because of the change of the 6-foot rule to 3 foot, that we will be back in full classes in K through 12 next year. I think we'll be wearing masks. I think students will be wearing masks because we won't have vaccine for students under 16. Moderna is testing their vaccine in children 6 months of age and older. Pfizer's testing their vaccine, and Johnson & Johnson has been testing their vaccine, but we won't have vaccine for kids before school starts. So, but we will be back fully. We won't have to build any new buildings to get back fully, because we're going to be able to put kids closer together. The science says that K through 5 kids don't transmit disease to each other or to adults. I believe that data. We have a couple of outbreaks happening currently in childcare in Kittitas County, and there may be some. It'll be interesting to see how many kids and how many adults in those facilities. But K through 5 kids, we've not seen transmission. The middle school and the high school are more difficult. If we can convince parents to vaccinate their 16 and older children, that'll really be helpful. Kelly asked about, can we get together with coworkers without masks? So currently the answer to that question is no, not because the science isn't there. So if you look at the CDC recommendations, it says that you can get together in a household with another couple that is vaccinated, with a few people that are not vaccinated that are not high risk. It doesn't say anything about workplaces. And the reason is that when we go to somebody else's house, we know who's vaccinated. And right now none of us are carrying around, well, some of us, like I have my vaccine card in my wallet, but I'm not whipping it out so I can go into the grocery store. So we don't have a vaccine passport. I don't think in the United States we're going to have a vaccine passport for things, but it has come up on conversations that I've been on with business owners in our community about, can they require people to be vaccinated? But I think what we'll find, Kelly, is that that scientific-based information that you as a I'm just going to assume you as a vaccinated person is not going to give it to somebody else who's vaccinated. But right now the regulations don't allow getting together in team meetings. But I think that'll happen this spring. Cole asked, can vaccinated people still acquire transmit disease? It does not. It appears. So President Trump did a really, maybe the biggest public health thing that has ever happened, which is getting vaccine out in such a short period of time. That required tons of money, lots of smart scientists working to do that. But we don't have the endpoints of those were, is it safe? Is it effective at stopping death and hospitalization? Because that's what we were worried about. It does appear that the vaccines stop transmission, maybe not 100%, but I think we're going to get to that point. Somebody who's vaccinated can currently, if they got exposed, do not have to be quarantined. If they're asymptomatic, do not have to be quarantined within 90 days of their vaccine date. The data is looking like that's at least 6 months now, and as we get more data, that's going to answer the question of whether or not we're going to have a booster, whether we're going to meet herd immunity, those kind of things. Joan should be happy because we now have more kids that can go watch football. So Joan, it's okay to push on things because that's how we get things done. So if the 6-foot rule changes, there'll be changes to school this year. So I think we will have schools in our county when that changes. Well, we already have some schools that are coming back fully. So Thorpe is coming back fully. They're a really small school. They're using their gym. They've been pushing to go to 4 feet for quite some time. I think what we'll find is some schools will be able to do that and some schools won't. I think from Washington State as a whole, all of you have taken a huge step to have kids back in school because you think it's important. That is not the case. Well, people think it's important for kids to be back in schools, but people have not been willing to take that step and say, I'm willing to do this, even though I'm not convinced of the science. It's important to me. I'm willing to do this. And I think there will be some schools that say I know the schools in the Methow Valley, they're gonna open fully if we go to the 3-foot rule. So there will be some that are able to do that. There will be some that are not going to be able to do that. Yeah, so yes, if I had so I think K-5 should be back this year. I think the data shows that there's not transmission in those things. I think the OSPI and the governor's office needs to push on that. President Biden and First Lady Biden, Dr. Biden, are pushing hard on that. I think the science tells us that. I think a big issue with that is if we can't have everyone back if we have the 6-foot rule. It's just not possible. But if we don't have the 6-foot rule, that's just a good lesson for me, Ginger, to not say snappy things that I have to apologize for later. But I think if we can prove to people that prove to the CDC and then prove to the governor and prove to OSPI that it's just as safe to be at 3 foot, especially with the K-5. There's not a reason that K-5 can't come back, because those aren't the kids that are transmitting disease. And in our county, we've had 138 cases of COVID in all of the schools. We still have not had one documented intra-school transmission, and that's because kids are wearing masks. That's because teachers are doing an awesome job of getting kids to wash their hands and stay apart and those kind of things. The other thing I'm working on K-5 is working on, if they're not transmitting disease to each other, why do we really have to have the K-5 kids wearing a mask outside? Right now, the K-5 kids have to wear a mask when they're on the playground. I think that's a piece that I'm pushing on. When we're fully vaccinated, we get tested only if you're symptomatic. So we have had a few cases of vaccine failure in even in a vaccine that has a 95% efficacy rate. You're going to have some breakthrough, and all of the people that have breakthrough COVID from that have been vaccinated, those are all being tested for variants, because that's probably more likely to be variant disease than wild type COVID. So Joan asked about travel. So the governor's guidance on travel is still the same governor's guidance on travel. That's not going to change before spring break. That is, if we travel out of state, you should, quarantine for 14 days. It's not a shall. And the reason it's not a shall is that I could go do something in Liberty over next week and be just as much of a risk as somebody going to Idaho. So, but we just don't, we really don't want people to travel. So the school has a policy in regards to travel that has changed, and maybe Ginger can talk about that. But from a public health standpoint, if you are vaccinated, you're at less risk with traveling, but none of us are at zero risk. And my goal for the county is to get us all back in school, to have businesses open, to be in phase 4, to have maybe even not be in phases anymore by the summer, to have a rodeo, all of those things. And to do that, I'm willing to stay home over spring break. I mean, that's just my own personal choice. But
Dr. Larson,
yeah, go ahead.
I think the question is, what we're asking employees to do is if they go out of state to take the rapid test when they get back, like once when they get back, and then again later in the week. So even if someone's vaccinated, is that still a reasonable or recommended process from your perspective if they've had the vaccine?
Yeah, I think it's still a reasonable approach. I mean, that's what that's allowing people to do is still to travel and not have to use all their comp time and those kind of things by having to quarantine. Yeah, I think that's still reasonable. Will teachers be allowed to teach without a mask in the fall? So I don't say it depends as often anymore as I did a long time ago, because there's been more science, but that will depend on whether or not L&I and the governor's office and OSPI can get together and say that. I can tell you, as somebody who's looked at the vaccine literature closely, I don't think you would be putting anybody at risk by not wearing a mask, but that's just me looking at that. The other issue with that is that gets back to the whole vaccine passport. Who's vaccinated, who's not vaccinated? Are we willing to share that information with others? How are you going to prove that a teacher who is not who is vaccinated? Although there's precedent has been sent to that, because if you look at flu vaccine at the hospital, we tried to do mandatory flu vaccine because that seemed like a really good idea to me. I spent a lot of time in court and talking to lawyers about whether or not that was legal, and it was determined that it was more work than there was more work than benefit, and there's a certain number of people that have chosen not to vaccinate with influenza vaccine, and people that choose not to vaccinate either because they can't, or they choose not to because that's their belief system. Those people have to wear a mask through the whole flu season. So that's a hospital policy. So if you see people at the hospital wearing a mask in the winter, maybe they're sick, and maybe they have a cold, although they shouldn't be going to work, but maybe they just can't, maybe they can't vaccinate. Maybe somebody in their household can't vaccinate, or whatever it happens to be. So there may be something like that. That's really a hot topic that people aren't really willing to wade in. Although in Israel, their vaccination rate's about 70% currently, and they have a vaccine passport. And I think that we will have to have, for travel, for the foreseeable future, we will have to have some kind of vaccine document to go out of the country to lots of places that have less ability to be vaccinated. Similar to a lot of the places that I went to in West Africa and worked, and in the Southeast Asia that have yellow fever. I had to have a yellow fever card, and I had to show that when I went into the country. So I think we're going to have something like that. I just don't think we're going to have that. You might have some businesses in Ellensburg that say, our business recommendation is that you have to be vaccinated, just like in Texas, even though they don't have a mask mandate anymore. There's a lot of businesses that say, as a business owner, I'm going to require you to wear a mask when you come into my business. So I think we're going to see some of that.
Hey, Mark, just briefly on that question, I think that's an opportunity for potentially or you and I to partner on trying to get some of this answered as far as the risk factor, because I think that having, especially for the younger primary grades, that ability to actually see a face and see how words are formed and build that contact and rapport is critical. So I think that's an area where we should be getting together to figure out, as you said, which levers to be pushing on with L&I to make sure that we can have that option.
Yeah, and you may have more of a push on L&I than I do. They seem like nice people, but they don't really listen to me very much. So when the CDC, and I've been talking to a lot of folks at the state on the 6 foot, 3 foot rule since our discussion last week, because all this data now is coming out. So when the CDC, the MMWR comes out, that's really the Bible in regards to science. And that doesn't mean that everybody has to follow that, but they have to be choosing to follow it not based upon science. Right? They have to say, okay, well, I'm not going to follow that recommendation because of X, Y, or Z, and it may not be science-based. So I would say we're looking at in the weeks, not months. So I had a long discussion with Scott Lindquist, the state epidemiologist and now the interim state health officer, about this just the other day, because we were talking about trying to do a 3 foot pilot project up in Cle Elum, and we were kind of shut down in regards to, from a legal standpoint of doing that. I mean, there's things like human subjects committees and those kind of things that we weren't able to get through. But at least according to Scott, it's happening soon. So I would expect that document from the CDC to be coming out this weekend. And I'll just forward it to you when it gets out. And since the governor weighed in on this whole thing, saying schools have to be back, I think by whatever date he put in his, when I was listening to that, I just didn't listen really closely because it didn't really affect us because we were already doing all those things here. But I'm going to say that once that document comes out, that's going to be high on the governor's to-do list.
So just for clarification, Dr. Larson, CDC, they'll come out with their recommendation based on science, but the governor still has to work with L&I and DOH to officially change the 6 foot rule in order for us to do anything different, correct?
That's correct. And if you just look at the CDC's come out with guidance for nursing home visitation, for example, and we're still waiting for the state, which I think that's going to come out this week too. The state, because I'm on a call on Friday afternoon in regards to nursing home guidance, they have to look at that and then they have to say, do we want to apply that in Washington State or not? Another example is quarantine for people who are close contacts. The CDC came out with a document that said 14 days or 10 days or 7 days with a test, with 14 days being the safest. And it took us a while in Washington to kind of come around to coming up with what we're currently doing in Kittitas County, which is 14 days or 7 days with a test.
The commissioners will be pre-drafting a letter as soon as that CDC report hits with the 3 feet to go off right away. That'll be pre-ratified. We want to make sure that gets in as soon as possible, that we support a move to 3 feet.
And Corey, I would make the suggestion that if you'd like for the school board and the superintendent here and probably the rest, even the other districts, to help sign that, if you think that would be helpful, I think we would be very much in support of that.
Absolutely. We will round up with everyone to make sure we have a very broad response to it. Thank you, Ginger.
Other questions for people. So if you haven't been vaccinated, please go get vaccinated. Because that's what's going to keep us moving. That's what's going to keep us moving forward, because it'll keep our numbers down. And then be careful moving into phase 3 that we don't just let our guards down like we did last summer, and because we were tired last summer, and now we're 9 months more tired, and it's going to be very normal to say, okay, we're now in phase 3. I'm going to let my guard down, and we're not quite there. We're close. We're really close, but we're not quite there. I think we just have to wait and see whether or not how big of a bump we're going to get with these variants. That's really where we're at. And I think if we get through March, and certainly the end of March and early April, that's going to tell us that a lot. So other questions, concerns?
If we go to 3 feet, is it possible with our space for all kids to go back? That would be something we have to look at. My understanding is when we did all the measuring, that it would, but we would be looking to building coordinators to do the measurements and take a look at what's in the classrooms. We'd have to go back through and remeasure things and make sure that we are, staying absolutely adhering to the safety guidelines for sure. And just a reminder, I did before the noon Zoom last week with Dr. Larson, I also included the applications if you're interested in volunteering for the clinic. I know I'm looking forward to doing that after I get my second shot, which will be next week. Just encourage you, if you're interested, to do that. For those of you that have been in, it is just absolutely amazing, the system that they have there, and just how welcoming the atmosphere is. And so I know I'm looking forward to being able to volunteer once I have my second shot, and just to encourage people to take a look at that if you're interested. All right, Dr. Larson, and thank you, Commissioner Wright. We appreciate your being with us and for your support. And as always, Dr. Larson, we appreciate all of your advice, and you've just been so wonderful to be meeting with us once a week, and it's really made a difference for all of us. So thank you.
Oh, you're welcome. Yeah, and Carrie, I reached out to answer your question about postal clerks being eligible in the tier that opened today. I reached out to Chelsea Leffers, who's our deputy incident commander, and I will get that information to you as soon as she gets it back to me. I think the answer is yes, but I want to get it from the horse's mouth. All right.
All right. Thank you, everybody.
You're welcome. Thank you.
Have a great rest of your day.